experts and representatives from various central ministries and state governments, multilateral and bilateral organizations, CSOs and guests. Ladies and gentlemen, a very good morning to you all. It is indeed an honor and privilege for me to be here on this special day to mark the second International Day on Clean Air for Blue Skies. As we all know, many countries are increasingly facing issues with air pollution. The sources of pollution are many and context-specific. Irrespective of the source, air pollution has a massive economic and health impact as it is associated with several diseases and conditions, including cardiovascular diseases, respiratory diseases, that lower productivity and death, lead to premature death. Now, climate change, as you all know, causes air pollution, and air pollutants are drivers of climate change. So addressing air pollution will not only have direct health benefits, but it will also help mitigate climate change. Let's look at how India has been leading in terms of climate change and air pollution, addressing them. India has been leading in many fronts. For example, the climate action plan for the country is very comprehensible, and it has been implemented by many sectors. We also have heard about the National Clean Air Pollution Program, NCAP, with the goal of achieving 20 to 30% reduction in particulate matter by 2024. And this has been implemented for a few years now, which is again commendable. And today we will also be witnessing the launch of Prana, the portal for regulation of air pollutants in non-attainment cities, and dedication of smoke tower at Delhi, which again is something, a great initiative taken by the government and by the ministry. We also know very well that the Prime Minister, Mr. Modi, raised India's ambition by expanding the country's renewable energy target from 175 gigawatt to 450 gigawatt by 2030. Along with France, India is also a founding member of the International Solar Alliance that was launched in COP21 in Paris, that brought together 98 countries to endorse clean energy, sustainable environment, public transport and climate action. The Pradhan Mantri Ujjwala Yojana has provided free clean cooking gas to 80 million poor families to replace polluting biomass fuels, which is again commendable. New Delhi has finalized one of India's most comprehensive electrical vehicle policies in 2020 to reduce pollution from vehicles. We are also seeing that cities are making progress with their leadership being demonstrated in Ahmedabad, Pune, Surat, Bengaluru to drive city-level action to improve air quality. Now, I would like to share a few things about what WHO does. WHO is a proud partner of India's national endeavors in climate action and efforts in improvement of air quality. One of the key roles of WHO is to synthesize evidence on the effects of air pollution on health. WHO has published various guidelines and recommended limits for ambient air quality based on global scientific evidence. In addition to these guidelines, WHO continues to develop and publish training materials for stakeholders in the health sector. Air pollution is one of the key thematic areas being supported through the Interministerial Environment and Health Working Group led by the Ministry of Health and Family Welfare and co-led by Ministry of Environment, Forest and Climate Change. This initiative is supported by WHO and UNEP. WHO, UNDP, UNEP and UNICEF have partnered to create a new compendium of 500 actions aimed at reducing the disease burden driven by environmental risk factors. You may kindly have a look at that. It's a very useful resource material. WHO has been also working with partners on the Breathe Life campaign. It provides a platform to share best practices, facilitates local government and municipalities to expand monitoring efforts, accelerates and supports municipalities in implementation to reduce air pollution, and empowers citizens by educating them about air pollution and provides solutions to mitigate its effects. Cities like Nagpur, Dehradun and Bhubaneswar have already pledged their commitments to the Breathe Life campaign, and I hope more cities will follow. WHO also works with the National Disease Control Program in the Ministry of Health on various aspects of capacity development of health workers on air pollution and health, climate change. We also are working together on disease surveillance, including climate and air pollutant indicators, as well as we are working on climate resilient hospital infrastructure, which was piloted in Madhya Pradesh, and on health vulnerability and adaptation assessments, again which was piloted in Rajasthan. So finally, I would like to conclude by reminding ourselves that air pollution is everyone's business, not just one ministry alone or one organization. Alone we can do little, together we can meet our goals for blue skies, as we have heard from the vision of the Prime Minister as well. A multi-sectoral approach is critical since the sources of pollution span different sectors in agriculture, transport, manufacturing, municipalities. There are many polluting sectors, and we need to all work together. And regulation of these sectors is also very key, and therefore the important role of pollution control boards at the national as well as state levels. WHO is committed to support the government to address health impacts of air pollution and climate change. On this International Day of Clean Air and Blue Skies, let us as individuals resolve to take and demand action to reduce air pollution by bringing in transformative changes in our lifestyles. Let us also through our organizations take initiatives to reduce air pollution throughout the year. Let us commit to ensure healthy air and healthy planet for everyone. Thank you very much.